and I am still and wait here in silence till you come and sit a while with me. You raise me up so I can stand on mountains. You raise me up to walk on stormy seas. I am strong when I am on your shoulders. Raise me up to more than I can be.
Good afternoon. Sometimes I get on the air and attempt to record something that I think can be beneficial to many families around the globe. Um, I would actually say that this presentation is not just meant for those students who are starting to take an exam in neurocognitive disorders or something like that. But it is specifically meant for families. Why? Because this is something that sometimes is not discussed within families. Families see about it, and but based on my observation and based on my family experience, I thought it was wise for me to come to the air and share this information with all of you, my viewers around the world, within the family. I think you would benefit from this presentation, and it will take about 20 minutes, and hopefully you can hang in there and just follow this presentation closely. Um, Positive that it is going to make a big, huge difference in your lives and the way you interact with your family members and with your friends. So the case is about dementia or Alzheimer disease, as you all hear about it. But I want to talk a little bit about you talk about dementia, you are talking about some sort of dimension, somebody's demented. What does that mean? It means that probably that person is declining. The mental part is actually declining. And when it comes to Alzheimer, so we start talking about a syndrome. It's not actually an illness, it is a syndrome. And that's what I want all of you to get from this presentation. Um, I would first introduce who I am so that you know who is talking. And in that way, if you want to reach out and you want to contact me, you are free to do that. My name is Dr. Christopher Arori, and I happen to have worked in hospitals for a long time. I did part of my training. I did clinical psychology back in the 90s, and then I decided to branch into nursing, and then I did nursing. I went to public health, but I have a PhD uh, in basically in the healthcare industry. So, and I've taken care of patients who have a dementia, who have the Alzheimer, which is a neurocognitive syndrome. Now, let me define this for you so that we can get along, so that we can move along this presentation. So, when you think of dementia, you are thinking of that decline in somebody's memory, in your loved one's memory, or the mental capacity, basically the processing, that normal, what you would consider as normal, just like me presenting, that you consider as brilliant, is making sense, that part goes down. And what causes all this to go down? That's what I want to discuss with you. I'll be asking myself questions and answering those questions with the hope that you would get the message that I'm trying to share with you. So when some when any individual has dementia, so what we are thinking of is there is some abnormal accumulation, some cells are being affected in the brain. And for the sake of just simplicity, we basically have some cells, these cells which are in your brain. Those cells, they're the ones which communicate with each other. You know, one cell will pass this message, the other one will say, okay, all right, welcome. And they will move that cell to another one. In scientific terms, they call them neurons. In other words, they are like highways in the brain. So what happens sometimes, we hear something like the development of blocks, BLAQUES, and tangles. So these plaques, they accumulate in those highways, and once that happens, you know, you expect that blockage to occur. And so when the highway is blocked, so that person is not going to, the cells are not going to communicate appropriately. And but for I want to define what these plaques are, what they look like. So that would be the buildup of substances from a fluid, such as cholesterol, for example. Fluid is changed and it is hardened. So it's formed and deposited along those highways, which are called neurons. They have an axon there, you know, which is a highway, and then where the cell, which is like a body, and then you have the pathway. It moves along that highway, but those blocks are just deposited along those highway. And then the second one is what is called uh, tangles, which I mentioned. Those tangles are abnormal accumulation of a protein called the TAU. So what that is also another sort of misfolded, you know, those misfolded proteins, which are not supposed to be there, but they happen to be there because probably depending on the risk factors which an individual was exposed to. So they are deposited. So you have the plaques and you have the tangles. So when those highways are blocked, and usually there is, then cells are not able to communicate. And in most cases, based on scientific studies, it shows that most of those areas which are affected are they are basically part of the, say, the amygdala. These are big words, but I'll break it down to you. This is just very close, the bottom part of your brain, right back on your neck here, and also the temporal sides, and then you have the frontal lobe. So those areas, they control things like emotions. They will control like emotional behavior, motivation. That's how you get motivated. So if those highways have been blocked, imagine your loved ones, those highways have been blocked. So the messages which you and I receive are not able to pass through those lines. And then you start seeing some emotional disturbance. You start seeing an individual being sad. You start seeing an individual being confused. And some of those areas, because that communication, so the memory, because those are memory centers like the hippocampus and part of the cerebellum, but I will talk about the cerebellum later. But I'm talking about that amygdala part, and then you have the hippocampus. Which some of you may even try to Google that part, the hippocampus and the amygdala. So those areas control emotions, they control motivation, they control the way we memorize, the memory, long-term and short-term memories. So if the highways, you try to imagine, the highways have been blocked, so that individual is not able to process appropriately. They are not able to take in the information. They have long-term memories, yes, but the short-term memory, they're not going to be there. So try to visualize what happens if that is the case. So an individual is not able to process the information appropriately and they get frustrated. Not only getting frustrated, they don't understand where they are. The environment does not, the environment loses meaning. They do not understand where they are. And that's what causes many of the families or family members, they start getting frustrated because they're used to their loved ones making sense, Now their loved one is not making sense. And in some cases, some family members will take it as an insult. They'll think that their loved one is being intentional. It is an intentional act or intentional behaviors, but they're not, because has become a syndrome. Well, there is studies, of course, which have indicated that that accumulation of blacks and those tangles can start as early as the age of 20s, in your 20s. But if somebody was not active enough, not only, and I don't want to stigmatize this, by the way, there is some genetic predisposition which have been cited in the literature, and but that's when you get in your 20s, you're eating, your lifestyle, and all kinds of stuff. Over time, it shows that 1 to 2 persons. Once you get to 85, you're likely to develop this process. I mean, this syndrome called Alzheimer, and that's why I felt very important for me to present this to you. But and once you have this information in the back of your mind, then you are likely to relate to your loved one who is in that state, how you can take care of that individual. I think it is important to know about that. And then I mentioned about the cerebellum. The cerebellum, so imagine all those areas, because these are the areas that are usually involved. So the cerebellum also is very important when it comes to movement, that movement memory, where those neurons, those cells, they can communicate with each other, and then you are able to start moving around. But once those highways are blocked, so less the movement is impaired. You start moving, not in a normal way. You become there is the motor part, so the physical ability of moving around gets impaired as well. So you have the memory which has been affected, which is right controlled by the temporal lobes. And then you have the prefrontal part, those cells which have been blocked because now dopamine. You have heard, those of you who are in the scientific community, you have heard about dopamine and all that. Oh, it's in dope and all that. So that part, those neurotransmitters are not able, those chemicals are not able to travel along those highways, the axons, and go to the dendrites so that they can pass that messages to other cells. So it is blocked now. So you can't think straight. You don't know where you are. Your memory has been impaired. You have long-term memory. Your loved ones now, there is a disconnection. They can't, even because they do not understand that part. So they are confused. So hopefully this presentation will help you to start visualizing what actually happens and how we can help uh, individuals suffering from this syndrome called dementia or Alzheimer. The other part I just want to give you statistics how this condition is serious. It is something that affects millions of people around the world. For example, we see that Alzheimer increases with age, of course. But when you look at the statistics, and this could be skewed, those of us who are in the scientific community, sometimes we may, you know, kind of make these numbers look great for other countries, and other countries will appear to be less than other continents. But this is the stats which we have. Uh, uh, but the current rates. That's what I'm going to give you. So 46% of persons with dementia live in Asia, the continent of Asia. And then we have about 30% in Europe, 12% in North America, and 52% in less developed countries. Think about that. So it's a big number of people who suffer from this syndrome, and so it's one of those things that it can be reversible or irreversible. There are studies which shows that if it is identified early, you can kind of control it and manage it. And if it is associated with a physiological condition and illness, it can be treated. But for the most part, it's a syndrome. It is there to live, and it gets worse as people age, as individuals age. And so I move straight to the focus of treatment. When you have identified that your loved one is having this problem, then there are a few things that you could do. And those things, I'm going to mention all of them, but I want you to think of what I have said thus far as you listen to this number.
You raise me up so I can stand on mountains. You raise me up to walk on stormy seas. I am strong when I am on your shoulders. You raise me up to more than I.
So, the treatment always your loved one who is not now able to do anything. They become like babies. So they are waiting for one who can sympathize with the situation and take care of it. And that's why you need they need that shoulder. They need somebody to lean on. And some families get frustrated. They think their loved one is manipulating their thinking, and they try even to not to listen to them, and they even don't give them the care they need. It is at this point when an individual is not able to understand what is goes on in the environment that he needs most of our help, the help to uh, feed them, the help to move them around, the help to take care of them and give them that support they need. And some of so the focus of treatment in this syndrome or Alzheimer's syndrome include improve the quality of life of the individual. That's what you want to do. You want to just improve it, maintain it. Let that person have a good life because probably they had a very wonderful life. They used to enjoy stuff. Now they are not able because their brain has declined. Their cognition, their cognitive, that cognitive decline is at your mercy. You, as one who is able to think, memorize, understand, but you all can only do this if you understand the problem. As I said, it is there are those blocks, the tangles within the brain that has blocked those highways. So those messages are not able to connect and communicate with each other to make some sense. Okay, so ours is to improve the quality of life of that individual and support the remaining intellectual abilities, mood, behavior. So when they have these deficits, memory deficits, doesn't mean that they don't understand some of it, because I would give you a scenario. If you block maybe a line where water is going through, you try to block it, but a little bit can actually be going around that blockage. So they still have some abilities to process, but it's not as as accurate. They're not at their baseline, not baseline. Let me avoid to use that term. They are not at their normal level, meaning they're not the way they used to be. Things have changed. So ours is to support them, support what is left, and also to continue to treat any physical illness. Some of these patients, they have some comorbidities, meaning they have some illnesses like blood pressure, they have diabetes. Our goal is to treat that part as well, to continue treating it. Don't say, okay, he doesn't want to go to the hospital, just refuse. No, his memory is not communicating the way it's supposed to. So your goal is to try to treat that hypertension, to treat if it is diabetes, to treat if it is hypothyroidism, to treat if it's an infection. That's our part to play. We make sure that we take care of the physical part as we attempt to take care of the emotional part. Second, or the third part is to continue. No, the fourth. We must support also the family in setting realistic goals. It would be naive to set up a goal that this patient would be waking up in the morning and preparing their own breakfast. You would have failed your loved one. Or the expectation to set those goals that, okay, we'll set the food that they're going to eat. No, they're not, because the brain is not doing what it's supposed to do. Uh, so your goal is to make sure that you set those realistic goals. It will reach even to a point where they insult you. They say no many times. Set those realistic goals. Let them be where they're sitting. You want to approach them calmly. You want to go to them in a calm manner so that you don't startle them, because they don't understand. Number one, they will not even identify you over time. They will not know who you are. So our goal is to basically do what we are supposed to do, just like supporting, so that all family members, so it becomes a sort of treatment approach. All of us must be aware of what is going on, and the only way you are going to be aware as a family is to share this information. Share the information, what's going on. Tell them what Alzheimer is, what dementia means, what is this behavior's unique or new behaviors mean, because those highways have been blocked in somebody's brain. Yeah, they're blocked. Those blacks and those tangles, they're blocked. The other part of what you could do is limit all medications. So you don't want to give a lot of psychotropics, because some of these medications, they'll cause an individual to become sedated. It's just like they're drinking alcohol or they're on drugs. The little that is left does not need all that assault. In other words, you don't want to beat up the little that is left with psychotropic medications. But, however, there are times that these medications are necessary. Once they develop like acute agitation, when they are so mad, they are disruptive, they are trying to beat everybody and all that. Then that's the time when you have to stage a conversation with your physician, with a doctor of your loved one, so that they can adjust. There are some medications out there. They can, of course, I would assume that if your loved one is having this problem, probably they are on Aricept, ARICEBT, or they are on Amenda. All these medications help. They're not helping to cure the disease, but they slow the progression, and sometimes they can manage those behaviors, which may be some sort of, they're combative, they're aggressive, and all that. Then we use those. And there is also Risperdal. I've seen cases where the Risperdal is given, but at a small dose. Remember, your loved one probably is in the 80s, 70s, 80s, 90s. The liver is not that strong to break down some of those medications. So we have to, and your doctors, they should know about that. Okay. The other part is maintain the functional ability. How do you maintain the functional ability? So this is important. That's where this is what uh, a few tips that I can give you. Uh, what you can do is just to make sure that you have a caretaker who is there 24/7. And there is a reason why you get a caretaker. A caretaker is familiar. You don't change those caretakers all the time, because then you even create more confusion, because this patient, uh, they have declined cognitively, so they need a person that they can relate to, familiar objects. And the caretaker also needs some breaks. You have to give these caretakers break, because remember, they are taking the pressure, they are taking the not the abuse, but actually the challenging of those behaviors which are not like yours and mine. So they're taking that pressure from this patient who does not understand where they are, because the brain, remember, there is a blockage. Those blacks and those uh, as I call them, tangles. They're there. They're blocking. They're blocking those highways. So this caretaker needs a break so that they can go and take that deep breath. They need that break to breathe. And once they have that break, then they're able to come back and take care of your loved one in the way you expect it to be done. Then there is also scheduled activities. You want to schedule activities. The question would be, what type of activities? Well, this patient still, their systems are functioning. Toileting, for example, you need to set up a schedule. A schedule, either it means every 2 hours, every 3 hours, you have to take that loved one to go and use the toilet. You want to set up also the dressing part in the morning when they wake up. You want to make sure that you help them. But one of the things that we do, many of us have a tendency to even try to sort of make your loved one feel as if they are not able. Because even if, I mean, as I said, there is a little bit where those information is seeping through those narrow places, even with that blockage. So they have some cognitive functioning, but it is limited. But you want to help them do what? If they're able to hold a spoon and put food in the mouth, allow them to feed themselves. Okay. If they're able to dress, help them. Just assist them. Let them do it because that makes them feel better. They feel that they have not completely gone down. The question would be, you said the memory is gone. How are they going to feel? Yes, a little bit of it is still there. Studies have shown even when people have died, the last thing to go is the hearing. So who is to say that those who are demented, they do not have those feelings of just feeling that they're able to do some things, okay? And so the other one, as you can only assist the elder, those things that they cannot do. Utilize familiar music. I love it. So I've worked in places where those persons who have dementia and Alzheimer utilize the music that they used to love to sing. If they were in the church, if they were in the world, whatever music they loved, this is the time. You bring that music, a soothing music, let them sing. If they're able to play an instrument, piano, for example, just let them play because they love to do that and they sing beautifully. Because that, remember, the long memories, they're there. So get them that familiar music, let them get engaged, let them sing with them. And especially when during the time of meals, if you incorporate that meal, that some music, some soothing music, it can help. I've seen it practically. I'm talking about the clinical standpoint. I've seen that happen. So it is utilize all those skills. The other thing is walking or light exercises. You want even to move their hands, even when they're sitting. Some of you would argue, well, my loved one is in a wheelchair. How is he going to perform exercises? There are different types of exercises. There are what we call passive range of motion exercises, where you can be lifting their hands, let them lift. Also the legs, just do some exercise of those legs, up and down, stretch, bend, up and down. Those little exercises, they have something they do because they strengthen those what is left and they make the patient feel a little bit better. But avoid excessive exercises, light exercises. And as I said, you can utilize the passive range of motion exercises. And of course, those other exercises, you try to limit them. As if they're able to walk with them, but not long distances, small walks, and let them rest. So that is extremely important. The other thing which we could do is just make sure that when you approach them, you go slow and appear to be calm. Go slow and appear to be calm. Think about it. Because when you get old, all systems, they're not as fast as when you were in your 20s. So it is important that you approach them slow and go slow. If it is feeding, slow, go slow. Go slow, calm, in a calm manner, not in, you need to eat now, you need to do this. When you do that, they rebel. They'll try to attack you. They'll spit at you. They'll do all kinds of stuff. Remember, those blacks and those tangles, Tangles, those blockage, they are within those axons, those highways. You have the cell body and the highway and the dendrites. Those areas which say, okay, here the message, we have received the message, receive it, another cell then to interpret. Those areas in the amygdala, the cerebellum, and the prefrontal lobes, they have already been affected. You have those blockages. So your goal is to approach them slow and be calm. Then when you talk with them, but the other thing which we forget most of the time, and I'm about to finish, it is this idea of thinking that they still can see. If they used to have glasses, make sure that they have those glasses. Can you imagine they're trying to watch, see a lot around, but they do not have glasses? So their vision is blurry. They get frustrated. So give them their glasses. Let them be tested, the hearing. If they are not able to hear, and you will be calling and they don't respond, probably they have some hearing deficits. Let them be checked and even utilize hearing aids to decrease the frustrations of this individual who is not able to understand what is going on. They're not even understanding is the wrong one to use. They are just there as little children. And being at that position, what they're looking at is a person that they can depend on. They're not looking at it, but that's the expectation. That's what you would love your loved ones to do when you are in that state. And I'm hoping that you are taking this seriously so that you can make the life of your loved ones and also as families as you communicate so that you are aware about this and make use of it. Life will be a little bit better when you understand what's going on with your loved one. The other part is make sure that the room where your patient is well lighted, is well lighted. Lit areas without shadows. Don't want it to have so many shadows. So well lighted. Why well lighted? So that they can see. They can see what is around them. And also, one part that I mentioned about caretakers, make sure you maintain familiar faces, familiar family members. So you have to be familiar so that they can get used to who you are. They can connect. Still, there are little parts that is left of them about that brain. And so help them to be able to identify. In other words, the goal is to make their life precious, make their life comfortable, make their life worth living, make their life go peacefully when they finally call it goodbye. And at that time, you will be so much happy that you did your part. And if we do these few things, then we will help our loved ones live a wonderful life. And when they go, we can all, as family members, be satisfied that we did our part. In summary, so Alzheimer's and dementia is a brain condition. It affects the amygdala, the hippocampus, the prefrontal lobe. All those are structured, which are part of your brain here. This is the temporal part. And part of inside the brain, those areas control memory, motivation, emotions. They do. But when those highways are blocked, so they can't, nothing can go through them except little pits that go round. Just like I gave an example, if you block a tube and water is going through, some of the little water will seep through from the other side. There is still limited ability, cognitive abilities left. And that's what you want to support. Their long-term memory is intact. Short-term memory probably not gone, not good. And then what can you do? As I said, once you understand what's going on, our goal is to maintain that baseline, provide comfort, provide some sort of quality of life, as they go through their last stages of life. If you want to know more about this, for those of you who have internet, and as I bring this to an end, you can check on www, three W's, alz.org. Again, let me repeat, www.alz, like in zebra, .org. And if you do this, all of us, we can get our loved ones to continue living and have a comfortable exit when that time comes. And for sure, at that point, you'll be satisfied that you did your best. So, family members, we can do this. Thank you and be blessed. Be blessed.
I can